anything which is pertaining to mental health is always a combination of nature and nurture. You can never say it is purely genetic or nature, and you cannot purely ever say that it's only lifestyle and parenting and household. The way to imagine stress is it's a strategic response to emergency situations and survival. A recent survey from NIMHANS has actually shown that 60% of their patients in the OPD have delayed seeking mental health help by 1 year. So many physical health problems, cardiac problems because of lack of sleep. WHO is just talking about lack of sleep, direct correlation with cardiac arrest, direct correlation with heart health, direct correlation with gut health. They don't have a bank balance on which they are working. They have taken this plunge with a very strong belief in themselves, which is what I think is exemplary of this generation, that the self-belief is high.
Yeah.
But the self-belief is equally weak and cracks very fast because the frustration tolerance is very low.
Correct.
Future and the financial stress is definitely two things that the entrepreneurs deal with and really deal with.
Hi all, welcome to the Strategic Pulse. I'm your host Supriya Praveen. Welcome to today's episode. Today we are joined by Dr. Jyoti Sangle, who's a psychiatrist with over 25 years of experience. We're going to be discussing mental health in the modern life, the pressure our generation faces, and how to find the right balance. Stay tuned and watch the entire episode. Hi, Dr. Jyoti. Thank you so much for taking out time and joining us today.
Thank you so much for inviting me.
So we can start with the most basic question. What's the difference between psychiatrist, therapist, and psychologist? Most people don't know this.
Fine. Let's dissect it. So, psychiatrist is a doctor by virtue of being an MBBS, then an MD in psychiatry. So it's a doctor by virtue of doing the MBBS degree, and then you do a specialization in psychiatry as an MD, and so you are the person who is able to diagnose the illnesses, is able to prescribe medications for the same. We are formally not really trained in therapy, but yes, we are told the modalities of therapy, the types of therapy, and we can voluntarily take it up. But as a part of our MD degree, we are not trained in therapy. We trained in supportive therapy to help people after their diagnosis, to help the family navigate the whole process. But as such, if you talk about specialized therapy like trauma-informed therapy or client-centered therapy or group therapy or all, we are not really trained in it. Yes, we are exposed to it. But that's how we are doctors. Now, a therapist and a psychologist, if at all they are doctors, they are doctor by virtue of a PhD.
Okay.
First of all. Second, because they haven't done an MBBS, they are not the ones who can ever prescribe medications, and if they are doing so, it is unethical. Now, but they are more trained in therapy because they do a bachelor's or a master's in psychology, which they could do it in clinical psychology, in industrial psychology, in counseling psychology, in organizational psychology. They can choose their field to do the master's in. So they are the ones who are therapists and counselors or psychologists. So anyone who's done a bachelor's or a master's in psychology is a psychologist. A therapist is usually a counseling psychologist. A psychologist could be a counseling psychologist or a clinical psychologist.
Got it. Yeah, I think even I didn't know.
So when you go to a mental health professional, if you're going first to a psychiatrist, and if they think you need therapy, then they send you to a therapist or to a psychologist or to a so-called counselor. Now, if they really need diagnostic help in the form of clinical assessments and tests, then they send you to only specifically a clinical psychologist. No one but a clinical psychologist can run those batteries of tests.
Okay. So it's always suggested to first go to a psychiatrist?
Not necessarily. So you have the deal is reach a mental health professional. If you reach a psychiatrist, you don't require medications, you will get referred to a psychologist. You reach a psychologist, if you require medications, you will be referred to a psychiatrist. The point is to approach and seek help. Within the mental health professionals, you will get referred.
Right.
But
right.
reach out for help is the bottom line.
Right, absolutely. So, what was how was psychiatry when you began your career, and how has it evolved from all these years, and how the world sees mental health?
Okay, when we took up psychiatry, that was around, so I took it up in 1995. So it was a branch with no one, a person who didn't get into anything else would take up psychiatry because you just needed to do a specialization. So the person who, it was said that the least marks not getting into any other field, or the kind of ignored ones, or the ones who were good for nothing, would take up psychiatry. So that was the image of the branch. Also, but then it was actually Paglon ka doctors. So if a female is taking up, how is she ever going to get married, and is she going to remain safe? And if a male is taking it up, how is he going to run the house by becoming a psychiatrist? There were a lot of social question marks, and there was a lot of social stigma attached. The stigma continues, fortunately, at a lesser degree. But when if you ask me as an individual, my logic was, it was something that I was very, very keen to take up, and it was a specialization branch directly. So I didn't have to do 3 years or something else and then do a super specialization in something. Psychiatry was a super specialization by itself, which it continues to be. So that's how we started our journey. Today, yes, the stigma is much lesser. Very honestly, it's the need of the hour. So people are taking it up much more voluntarily, and there is need for many more to take it up. As a branch, it has evolved for multiple reasons. One, the stigma has come down. Second, the modalities of treatment and the options available for treatment are much more. The third thing which has worked in which has increased mental health problems but has worked in favor of awareness of mental health has been the pandemic. Because the stigma that people had, that we wouldn't want to be outside the chamber of a psychiatrist, or we do not want to be seen in a hospital with a psychiatrist, or how do we do this, that they could do from their own house in a closed room.
Yeah, online.
Online. So they were not so scared about the social judgment.
Right.
They could do it from in their own comfort zone, and they could do it more one-to-one and had many more options. So from the mental health awareness perspective, pandemic was a positive. It also increased the need, so it was something like necessity is the mother of invention. So that's what happened. So
yeah,
that's
a
how
lot of people needed it also during.
So psychiatry has evolved in that way. Now there are many more options for studying psychiatry also available, and the awareness and the need and the willingness to take up psychiatry is much more, and many are actually taking it up as their first option, which was extremely rare.
That's awesome. Very
in the
important
past.
also.
Yes.
So, how much of these psychiatric problems that you see in people are genetic, and how many of it comes from the lifestyle and the environment?
So any psychiatric issue, psychological issue, I wouldn't even say psychiatric, anything which is pertaining to mental health is always a combination of nature and nurture.
Okay.
You can never say it is purely genetic or nature, and you cannot purely ever say that it's only lifestyle and parenting and household. It's always a combination of nature and nurture. Now, there are two aspects to this. So, let me compare it to a medical illness. So, if you have diabetes, if you're freshly diagnosed with diabetes, the doctor automatically asks you, is there a family history of diabetes?
Correct.
But because the parent had diabetes, does not mean that the next generation will have diabetes. It only makes them a little more prone,
Correct.
but doesn't really necessitate that the next generation will have diabetes.
Correct.
It's exactly the same thing. So, if in the older generation we have had bipolar, does not mean that the next generation will have bipolar. But if the person is diagnosed, then we really ask for the family history. That there is no doubt about. Having said that, yes, the vulnerability is much more. But doesn't really mean that if I am diagnosed with something, my child will definitely have it. Absolutely not.
Yeah, this is helpful.
And does lifestyle play a role? 100%. It does. Does the home environment play a role? 100%. Do other external factors play a role? Yes, for sure. It's a combination, permutation combination. Each one has a different one. So the external factors could be substances, could be the home environment, could be trauma, could be so many things. So, but it's always a combination, nature and nurture. You can never swear and say it's only genetic. You can never swear and say it's only the family. It's a culmination of many factors in each person, and no two stories are alike.
Yeah, I mean, you must be seeing so many cases.
So no two stories are ever alike.
What are the early signs of someone's mental health declining, and how do we know if it's just general stress or clinical anxiety or clinical psychological problem?
So I'll answer the second bit first about the stress and anxiety. So the best way to imagine stress is that it's a strategic response for survival.
Okay.
It's a strategic response to emergency situations and survival.
Okay.
If this persists and if it causes sleep, appetite disturbances persistently, if it interferes with your activities of daily living, then you're heading towards anxiety.
Okay. Yeah. Very well explained.
So, stress is a strategic response, emergency response to an emergency situation and survival. STRESS. So, it is that emergency situation, survival, response, stress. But if it is going to cause you clinical symptoms in the form of lack of sleep, lack of appetite, it affects your activities of daily living, it doesn't let you concentrate well, it's making its presence felt,
Right.
then you are heading towards clinical anxiety if it persists for more than 6 to 8 weeks.
Okay. Okay.
So there is everything. It's the intensity, it's the duration, it's the frequency, it's the interference in daily life. Everything together leads to a diagnosis. And that is a clinical diagnosis. So that's very difficult to kind of explain for a layperson to just diagnose. But yes, these are the warning signs that, okay, maybe I should go and at least take an opinion.
Yeah, I think this is very important, and like very nicely you have differentiated between both. And yeah, I think 4 to 6 weeks is like pretty short and still a good amount of time for people to visit, because I know people who don't seek help for years together and they're just there, and they are not even open to suggestions on how they should visit someone. So what would you suggest families who have someone at home like that, who's
So-
not ready for therapy, who's not ready to see a mental health professional, but everybody, like even people with the most basic knowledge, know that they need mental health help?
So the recent survey from NIMHANS has actually shown that 60% of their patients in the OPD have delayed seeking mental health help by 1 year.
Wow.
So there's actually a NIMHANS survey which has come out. So I would say be aware and beware. That's what I always say. So what's important is be aware that if there are sleep disturbances which are persistent, if you're not getting up fresh in the morning, if there are appetite disturbances, if there is disturbance in activities of daily living, as I said, if it's interfering in your work, if it's causing immense fatigue, if it's causing concentration issues, if it's causing you mood swings, if it's causing you irritability, and if it's causing you unexplained fatigue, there is something which is not right.
Absolutely.
And then at least consider seeking help. That's the first baby step. Once you consider, maybe you will actually go up and take that step, but at least consider. At least think about it. Don't just kind of sit over it and say, I can't have it. It's not
Yeah.
me. And the biggest thing is, like we said, the myths of mental health. So there was a time when mental health, I call it the 3 M's. So mental health was madness. Well, none of the symptoms which I just spoke about speak about madness.
Yeah.
The second myth is that medications are always dependency producing, or they're going to affect your liver, they're going to affect your kidney. Well, yes, there are medications which need to be monitored, but not all medications cause dependence, and not all issues require medications. So, mental health is not synonymous with medications.
Right. Right.
So, mental health is not madness. Mental health does not mean that medications will cause dependence. So, that's the second myth that we need to bust. And the third is that if I'm seeking mental health help, I am weak. If I'm going for therapy, it means character weakness. It means that I have not been able to take care of myself. Mental health issues are not a sign of weakness. So the three
Right.
M's, if you are able to navigate in your own head, and these are sentences all of us have spoken, have believed, have been through, and have managed to bust at some stage or the other. That's the need of the hour.
Yeah, people say you're not strong enough, and that's why things are
Yeah.
happening. So, do you think our generation's constant need for being productive and chasing success makes us feel that relaxing or taking rest is with a lot of guilt? Because I myself experience that if I'm taking a bit of rest, I feel like I'm not being productive enough. And I mean, was that the same even previously, or is that something that's coming up with this generation?
So my question to everyone is rest a reward or is rest necessary?
It's necessary.
So if it's necessary, then there is no discussion here.
But how much rest? Like for someone, it could
It's
be.
different. Yes, it is very individualistic. So there is no benchmark of how much should the rest be. But it definitely, sleep of less than 7 hours is definitely not okay. Now, having said that, I could be a person who's productive at 5 hours. I could be a person who's not productive even at 10 hours. Then there is something that we need to figure out. Why? Having said that, let's look at the normal societal standards. So then, sleep, rest is a necessity. Most of us have started treating it like a reward.
Right.
So I have had my day. Now I need to be rewarded by rest. And what is the rest? Rest is what I will decide rest is. The rest is not synonymous with sleep.
Correct.
Rest is not synonymous with rest. Rest is synonymous today with me time, which is a reward to the work that you put during the day. The work which you put during the day was supposed to be the work you put in a day as a human being.
Correct.
There is no need for you to be rewarded for what you have done naturally during the day, which is what you were supposed to do. You are supposed to go to office, you are supposed to study, you are supposed to see patients, you're supposed to do your job. You haven't done something like done something for which you need to be rewarded.
Correct.
You're not doing anyone a favor by doing your own job or your own work. But there's the verbatim seems to be that rest is my reward. And the me time then leads to me needing my me time and winding out time at night. So I am going to finish my work at a godforsaken hour anyways. And then I am going to want my me time, which is another 1 to 2 hours. And in the process, I am going to procrastinate my sleep, which is called revenge procrastination of sleep.
Okay.
Why? Because I am taking revenge to the fact that I was kept busy during the day when I could have done this. So
Yeah.
I will take revenge on the day by getting my me time. But what am I procrastinating? Sleep. So what am I actually procrastinating? Rest. I have taken my me time, but I have procrastinated my rest. So
Correct.
I am not going to get rest. So I am going to get fatigued in the morning. So my efficiency is going to be lesser. So I am going to be more frustrated at the end of the day. So my me time requirement is going to go up. So my revenge procrastination is going to go up. And I have entered this cycle where there is no rest.
Yeah, I think that perfectly describes our generation today. And
So that's what has happened. So even if we look at our parents find it very natural to switch off the lights at 11:30 and get into the room and sleep.
yeah.
For us it is like 11:30. Why are you switching off lights? So the difference starts there.
Yeah, so the ideal thing is to finish the routine, finish the work, and sleep. Like, we don't need to treat rest as reward and
It's a
try
natural
to-
thing. You're not supposed to rest. Your brain needs it. Your body needs it. You're not doing it a favor, and you're not doing anyone a favor by working.
So, while we say this, but how do we know if we need to push ourselves in a particular situation, or we need to just stop for the day and take it slow and just rest?
According to me, the body gives you enough symptoms.
Okay.
So you can kind of take periodic checks on yourself. If your energy level is beyond 7, please continue. If your energy level on a spectrum of 0 to 10 is at a 5, it's time for you to pause. Think, recuperate, give yourself a break. Because you need to function only when your energy level is beyond 7.
Okay.
And if it's lesser than 5, time to take a break.
And this we have to judge for ourselves.
Nobody can judge it for us. So at least periodically judge that. And I agree that you may have deadlines. Corporate world is not kind. Our own lives are not kind, and there are deadlines and simple things. There are people who can't meet deadlines. There are people who are multitasking. It's more easily said for me than done by everyone, which I completely understand. But at least twice or thrice a day, if not 8 times a day.
Right.
And it is extremely important to introduce short breaks in between. You cannot like go on full throttle and say, why is my brain fried? It's something like telling a horse that why are you not running? I need to eat in between to be able to run. I need my legs to rest for me to continue the race. You can't make me run the final jockey race every day.
Correct. So you mentioned about how these days corporates and the whole work culture demands a lot from individuals. So is there a mental health cost that is attached to being too ambitious? Because the more people work, the more they get recognized, the more they get promoted, the more they get incentivized. That's how our whole most of the work cultures are defined.
It's going to come at a cost if it's going to cost you your sleep. The moment it is costing you your sleep, it's costing you your health. If it is coming at a cost at you cutting off your social support on your social networks, it's coming at a cost.
Okay.
Because finally, the way you will live your life or the way you will continue is by this social support system. And if it's getting you to cut off from there, it's coming with a cost.
Correct. Correct.
If it's coming with a cost where you're going to develop physical health issues in the form of the carpal tunnel syndrome or the head shoulder syndrome or the lower backache, you're spending the same money in an MRI. I don't think we've achieved anything there. Yes, you can run a rat race. You need to run a rat race, unfortunately. But what you are doing is exactly what your children are going to learn to do.
Okay.
So if you are now going to sleep, if it is natural for you to come at 12 and get up at 6 and pack in the gym and pack in everything, your child is going to learn exactly that. So the child is, and each generation needs to do more than the previous generation.
Yeah.
So the number of classes I have taken my child to, I don't remember going for those many number of classes.
Correct.
I don't remember my mother running around with me for so many classes. And the academic competitions and this and that, I don't remember my parent doing it with me, but I did it with my son. So I think each generation is coming up with something different and new to do, which is adding on to what was already existing. So it's going to be natural for the next generation to believe that lack of sleep is okay. We,
Correct.
at least at one point in time, we at this generation at least look at parents switching off lights at 11:30. The next generation is looking at a generation switching off lights at 1 o'clock.
Correct.
So they are going to switch it off at 3 o'clock. What are we achieving? It's, according to me, where we are heading is, it's coming with a cost of our own health. It's coming at the cost of health of the family. It's coming at the cost of health of the next generation. And what we are achieving is more materialistic. Because basically when we are sleeping, we are not at peace. Because there is some incentive we are still to get. And when we have got an incentive, there is another incentive that has not come in yet. And this new thing about retiring early at 40, 45 is kind of making you work like a dog is the best word I can think of, in spite of being on a public platform. But that's how you're working, because you want to retire at that 40, 45. So by the 40, 45, you are a nervous wreck by anyways. You're whatever you have, you're spending the rest of the 15 years which you could have worked in a hospital anyways with health problems. We are seeing so much of early dementia. Why? Because you're not resting the brain. Because you're just pumping in it with supplements which are unnatural. We are seeing so many physical health problems, cardiac problems because of lack of sleep. WHO is just talking about lack of sleep, direct correlation with cardiac arrest, direct correlation with heart health, direct correlation with gut health. The cardiologists, each prescription has a sedative in today's date. Because in spite of stenting a patient, they are not very sure whether he'll come with a second one. Because he will go back to his normal lifestyle. The number of epilepsies that are being diagnosed just because of sleep deprivation is not funny. The EEGs are normal, all the causative panels, all the investigations are normal. Sleep deprivation is the reason a person has got an epileptic attack in a office. This is, we literally ruining forget mental health, we are ruining our physical health just by lack of sleep. So that's the cost the ambition is getting us to pay. I'm not saying it's wrong to be ambitious, not at all. But so do as much as your body allows you to do. Don't consider it to be so even if a computer, you can't make it work beyond the speed for which it is programmed, right?
Correct.
You can't store more than what its storage space is.
Correct.
It gives you an alert. Your storage space is over, 86% of it is exhausted. Please buy a new hard drive. Please buy new storage. Even a computer gives you that alert.
Right.
Are we allowing our body to give us that alert?
Yeah, we need to be more aware and listen to our body.
And the body always gives us signs, always gives us signs. It will give us signs in the form of sleep, it will give us signs in the form of fatigue, it gives us signs in forms of gut issues which never had, it gives us signs in form of memory and absent-mindedness. It gives us so many signs. It's so many signs. Mouth ulcers. It gives us skin picking. It gives us nail biting. There are so many signs the body gives us that, okay, you're overloading me. Stop.
Yeah, this is a serious issue. But who has to start a solution for this? Like, who
I
has the
think
power?
each one to himself. So I don't think I owe my health to anyone, and I don't think more than me anyone would be bothered about my health.
Correct.
So if I talk of it in a very philosophical way, tomorrow if I go, who's bothered? What difference is it making to anyone's life? I believe I'm indispensable, but actually, what difference does it make to anyone's life? I'll just go. So I have been collecting this money for what? I'm going. I've gone.
Correct.
So it's for me to believe that, okay, what am I doing? I have to be able to enjoy what I'm trying to achieve.
Correct. Correct.
Just going to the stage once, getting a trophy, getting a prize, getting an incentive, getting a recognition. People will clap for me for 5 minutes. After that, I'm a human being.
Correct. Correct.
So I may sound philosophical in this part of it, but according to me, you pushing your physical and mental health to achieve something which you may not be able to enjoy.
Correct. Correct. So, with the surge of entrepreneurship in today's world and this whole decade, there's an increase. Do you see a lot of entrepreneurs coming to you? Is there an increase?
Yes.
And what problems do they usually come to you for? And is there a difference in the way they deal with problems as compared to other working professionals?
Yes. The underlying common problems are sleep, inability to concentrate, focus, be happy, always being on the edge, what next, fear of failure, fear of rejection, and FOMO, fear
Yeah.
of missing out on what they are really missing out. So, this is common, I think, everywhere. In the entrepreneurs, I think the additional thing is the financial stress that they go through. Because there is a lot they have put in, and there is usually a lot, it's a very thin rope on which they are hanging on,
Yeah.
and they usually have too many people clutching on to them hanging on.
Correct.
And usually when they're doing it, it's a full-time thing. Very rarely is a part-time thing.
Yeah.
So
yeah.
they've most of them have completed their education in some little early part of employment, and then they want to start their own stuff as an entrepreneur, as a startup or whatever. So they don't have a bank balance on which they are working. They have taken this plunge with a very strong belief in themselves, which is what I think is exemplary of this generation, that the self-belief is high.
Yeah.
But the self-belief is equally weak and cracks very fast because their frustration tolerance is very low.
Correct.
And they are also a generation which is a generation of instant gratification.
Yeah.
Having said that, yes, the uncertainty of the future and the financial stress is definitely two things that the entrepreneurs deal with and really deal with. And that gets them very, very irritable. That gets them very irritable on the family members, and that we usually have families coming and complaining more than the individual himself.
Yeah. They're not able to give time.
So, yes.
But then, I mean, of course, when we hear it in the market from entrepreneurs, they say it's all worth it. but from your point of view, and when families speak to you and entrepreneurs speak to you, is it really worth it?
See, the ones who click, see, most of the advances that we have in today's day, be it your Zomato, be it your Swiggy, and be it your all these Blinkit, Zeptos, everything that we have had is a product of this,
Correct.
right? So yes, when you are successful, it is very good. But and everyone can say, if I don't take a chance, what will happen? I have to take my chances. Yes, but you also have to know where is it time to draw a line. You can't keep on doing it. I'm not saying don't be adventurous, don't be imaginative, don't be curious, don't be experimentative, but have a footing so that insecurity doesn't add to your mental health issues.
Correct.
I do not have the histories of each of the founders of these.
Right.
So everyone can say we also didn't, they didn't have, the Bill Gates did this one did. Agreed. The world is very different now. If you have responsibilities, be realistic. If you don't have responsibilities, remember that you need to have something to fall back upon.
Correct.
Adding financial insecurity to your existing insecurities is not advisable. And it does lead to mental health issues. So I feel just be a little more prudent, cautious, and then being experimentative, there is nothing wrong.
Right, right. And I mean, of course, apart from that, social media is everywhere nowadays, and which could also be a reason for people feeling FOMO. So, what's your take on social media? Like, is it increasing anxieties of people? Is it like, what's your take on that?
So social media has worked to both the advantage and disadvantage of mental health. I'll speak of the advantages first. It has really helped in creating awareness.
Right,
It has increased the reach of mental health to each house.
right,
It has made telepsychiatry possible in a lot of ways.
yeah,
And it has made communication so much easier.
right,
But unfortunately, the non prudent use of it, and the overuse of it, and the misuse of it has led to the flip side of social media, which has become such a big monster today that it overshadows the advantages that we had with it.
correct,
And it's a looming monster. So you have WhatsApp universities, we call it WhatsApp universities, we call it Google Chacha, we call it Instagram teachers, and we call it TikTok residents. So this is not to name anyone. I really don't want to kind of point fingers at any of the platforms, because all of them have worked to the advantage of mental health
of
also.
course, yes,
So, giving them that credit. But yes, the information there is usually not medically backed, factually not medically backed.
Correct.
So, it's half baked knowledge which is just there.
correct,
It needs to be verified. It's an extremely useful, non stoppable, what do you call it? Canon for mental health awareness.
right,
But it has to be mental health awareness. It doesn't have to be misawareness. It doesn't have to be wrong information. It doesn't need to be misinformation, which it is. So, the disadvantage that we are seeing, for an example, is people would go to Instagram and diagnose themselves to be ADHD.
yes, yes,
For an example, people would go to a platform exchange notes and decide that we have this particular diagnosis. It's a good screening tool, it's a good awareness tool. Don't diagnose yourself with that. Don't make don't make social media information your identity.
Correct.
It can create awareness. Come back to a mental health professional and try to verify what you have seen.
Correct.
At the same time, please understand that no AI, no social media will have more clinical knowledge than a mental health professional in today's date.
Absolutely.
In today's date, as of now also, a mental health professional has more hands down clinical information. AI is still building as far as mental health realm is concerned.
Correct.
It's not as robotic as a surgery can be.
Yeah.
So mental health is still abstract. So AI, social media is all trying to kind of get there, but the human touch that you need and the clinical experience that you need is still being integrated into those platforms. It's still in the nascent stage. So it cannot be more confirmatory or more informatory or more diagnostic than the mental health process.
Correct.
So yes, use the social media, but use it, as I said, beware and be aware.
Yeah. We see a lot of people self-diagnosing, especially with ADHD, bipolar, and all these common, like the behavioral patterns are so relatable to everyone that they start assuming.
So the loose words like, I am obsessive about this.
Yeah.
I have this bipolarity in me. So I am on the spectrum. These are very strong words, and these are not loose adjectives. So that there needs to be a lot of thought which goes into it while using these words. And we also see now people diagnosing themselves and coming and telling us and arguing with us that, okay, this is what we have diagnosed, you are not getting us.
That's not
So
good.
which is very true in today's date. But yes, if you have some piece of knowledge, you found something, please get it to us. Let's discuss it. But it, as I said, it cannot be more informatory, confirmatory, and diagnostic than clinical experience, at least at this stage. I do not know what the future holds for psychiatry. In today's date, I don't think it is the clinical experience and the human touch and the abstractness of it can be replaced by AI yet. It can be a great tool helping, screening, awareness. Diagnosis, I have my reservations.
Yeah, absolutely. I think you've put it very well. And yeah, I think people need to consult before making a decision on their own about all of this. So I have a very interesting question. Can psychological intervention treat physical symptoms? Like, because I mean, I am aware that some part of physical ailments or symptoms can be rooted in psychology. So if they heal themselves psychologically, can like almost big ailments be cured? How, like, have you seen any cases like that?
So if I can understand it correctly, you are trying to say that in body symptoms, does psychology or does mental health issues play a role, and can the body symptoms be completely explained by mental health issues at times?
Yeah.
Is that what you are trying to ask? Well, yes. The mind-body connect is very, very strong, especially with new research coming up. So I'll try to explain it at various levels. So it is, there are many body symptoms. First, every body symptom needs to be investigated. Only if you find nothing physical do you start looking at the functional overlay in it.
Okay.
So a dizziness, you don't start with saying that the dizziness is psychological. Only if my neurological examination for dizziness does not reveal anything, then I go towards psychology or
Right.
psychiatry.
Right.
Can anxiety cause dizziness? Yes. Can it explain dizziness at times? Yes. Can it be purely psychological? Yes. But I can say that only if I have investigated that there is no physical reason to it.
Right.
Okay.
Got it.
Similarly, various symptoms most commonly in which we find a psychological overlay is dizziness, acidity, mouth ulcers, tremors of the hands, breathlessness, quite a few times stomach ache, backache. We find quite a few times we find psychological overlays. Now, why? What happens is, for an example, if I get a pain, so obviously I get a little disturbed about the whole thing. Now, if I am an anxious person, or if an anxious personality, my anxiety goes up.
Right.
That feeds into the pain. The anxiety goes up, feeds into the pain. So I'm there. So that's the psychological overlay. So it's not that I don't have acidity. I may have had acidity over 2 or 3 days, but I refuse to believe that I have acidity. I go and do a lot of stuff, and then the anxiety just feeds in and feeds in and feeds in and feeds in. So yes, we have had times when we have treated the person more with psychological or psychiatric medications and really a medication from the physician. Quite a few times. That happens. That overlay is definitely possible.
So once that is healed, their physical symptom automatically goes away.
But then it also comes with an footnote that they need to be made aware of it, and then they need to be, the insight needs to be developed, and they need to be told that if you take mental health help to help this aspect of your personality in which your anxiety is feeding into the body symptoms, it helps. But that's the most difficult part we deal with, is the acceptance to that.
So, what's the link between astrology? So, some people believe that their tough time is going on and it's fed into their mind, and then they start seeing symptoms that way. They think they're feeling heavy, their time is not good, and then it's again like a cycle, like you mentioned. So, they start thinking their time is not good, and then they start getting affected, their health gets affected. So, what do you do in such cases when they are fed that their time is not good astrologically?
See, astrology has to be a science and is a science. So I wouldn't question that. I say, treat what you have. You believe in what you have. Maybe your time is not good. Stars are not aligned. Things will change on their own in 3 months. Believe all that. Do all that. But attend to your health. It's a science, so we are not here to question another science, because I don't understand the science, so I don't want to question it. So it's a science, it must be having some basis, people must be making some predictions on the basis of something. Fair enough. My appeal is to a person who believes that astrologically things are supposed to be aligned better. Wait for them to be aligned. Why are you suffering in the meantime? Get yourself treated, wait for the stars to be aligned, and continue with your life.
Correct.
Why suffer through the fact? Why believe that I cannot be helped?
Correct.
Help yourself, seek the help, and then continue with your life.
Correct. Yeah, I think that's important.
So
because
do your part of it. No,
Yeah.
if the stars are doing their part of it, of aligning and realigning themselves, you do your part of doing your job. It's
Correct.
as simple. The age-old saying, God is going to help who help themselves. If you are going to sit there on a chair waiting for stars to be aligned, the stars is going to say, why am I working alone? He is not working. So do your job. Let the stars come in their place with time. It's a science. Well, I'm not making a mockery out of it, but yes, it's a science. Look, I know only that part of it, so I'm using those words. But yes, whatever it is to happen. They say you do this ritual, you do this puja, things will fall in place. You go to this religious place, things will be better. Fine, do all that. But why suffer in the meantime? Attend to your health also during the meantime.
So, on the other hand, someone who is spiritual and has a strong belief system, are they more quicker with their healing of mental health because they have that belief?
So I would say basically man as a social animal and man as a psychological animal needs something to ping their life on.
Right.
Whatever it be it relationships, be it spirituality, be it work, be it relationships. As long as you have faith in it, it's your anchor.
Correct.
And anything can be your anchor as long as you're not overdoing it.
Okay.
And as long as you're not negating the rest of the sciences.
Right.
So I believe God will set everything right for me. I will do my bit. Fantastic. My anchor is my family, so I'm going to spend maximum time with my family and I'm going to do my bit. Fantastic. But being spiritual in a way that this is the only thing I'll do and God will take care of everything is not going to happen.
Correct.
But yes, it can give you a lot of peace from inside that you don't get rattled easily. Because you are used to finding peace in going and sitting in a church or going and sitting in a temple or doing your small ritual every time and feeling, okay, I have done my bit, I am at peace now. Nothing wrong in that. Along with that, do everything else that life is asking you to do. You can derive your strength from there. You can derive your peace from there. And many do that. All of us have some or the other anchor from where we derive our strength.
Correct.
Nothing wrong. As long as you're not overdoing it or you're not kind of denying yourself the other things that your body and mind is asking for.
Yeah, I think that's very well put. Yeah. So, what are the most common mental health problems that people are coming to you for? And basically, what's the trend? Trend is not a good word, but what is the trend that's going on? And people should be more aware that this also could happen to them because it's happening to a lot of people these days.
Anxiety, sleep disturbances, digital addiction, isolation, social isolation, not feeling fresh in the morning, fatigue. Usually, this is what we get in OPD. And then we sit and analyze it. The symptoms which are recognized or which are apparent are these. There's a genuine rise in ADHD, both child, adult, middle age. A lot of unmasking of neurodivergence, genuine one. We seeing a lot of increase in OCD. So yes, the trends are changing. I wouldn't say that we recognize it as a trend, but I would say it's previously you would recognize psychopathology only when it was extreme.
Right.
Now there are many more warning signs which are much more subtle and at the same time obvious.
Right. Right.
So those are things that need to be picked up.
So, are these on a rise because this generation is more sensitive and the previous ones were tough, as they called it?
I would say underline the same two factors. First, low frustration tolerance and instant gratification. Second, the demands on them were lesser on the previous generation. They had a much demands in the sense that they had a lot of more networking and a lot of more. So we have more. Um, Instruments and gadgets to do things. Our life is much more made more comfortable, but we are also getting more and more isolated.
Correct, correct.
The previous time, the ability to solve problems was more by talking.
Correct.
So that's one layer of it. The second layer of it is also that mental health never found an expression in the previous generation.
Yeah,
It was not a thing.
right. I think anger was just about lashing out.
It was just like you express what you need and get done with it, and everyone else is supposed to accept it. So there are two aspects to it. One where this generation does have more of it and has found the vocabulary for it. Has more of it and also has a better vocabulary. The
Right.
previous generation or a few years back didn't have so much of a vocabulary, didn't have so much of an awareness, but also didn't have as much problems because the
Right.
demands on them were of a very different type and not as competitive, not as isolating, not as cutthroat, not as cutting as now. And there was very little the construct of a FOMO didn't exist at that time.
Correct.
Now the construct of FOMO, identification with what you see in social media, the benchmark you compare yourself against, they're very different. So it's almost like, so people say a generation. I feel we've moved a century as far as mental health is concerned.
Yeah, yeah.
So it's very different.
So coming to more of emotions that people go through, and this question has been this topic especially about sensitive people. I feel like it's just discovered very lately because even though our parents' generation were sensitive, it was never discovered. So now it's just a whole different way they lead a life. Like I am, for example, a sensitive person, so and things affect me more, and all of that. So is there like a solution to that? Because sensitive people experience everything a lot more, and they're more, are they more prone to mental health, anxiety and stuff?
So when we are talking of HSPs or sensitive persons, one, yes, naturally sensitive. Another group which is more sensitive or comes in the HSP group is the neurodivergents.
Okay.
Another group which we usually see in the HSPs is the LGBTQ community.
Right.
We also see a lot of patients with a lot of trauma which will be in the sensitive person category.
Correct.
Now each one comes with a very unique struggle. I have enumerated just 3 groups, but many more are obviously included in this. Each one has their own set of very unique struggles, and struggles we can't even imagine and articulate, very honestly. So we were within our colleagues, we met, we were together some time back, and it's literally, how much ever insensitive I may sound today, but it's actually that we see patients and we think that things can't be worse than this for anyone else, and the next day we see someone else who's had a life so much more difficult than the previous day that we spoke about, And again we say the same sentence, and the third day we say someone else who's. It's the amount of, because of the newly discovered vocabulary everyone has, the struggles are so difficult. So it's I can't even say it's heartbreaking. It is so difficult to even imagine and fathom the kind of struggles these people come with. Because of the background, because of their individual journeys, from their struggles not being recognized, to them gradually reaching a place where they are able to articulate their struggles, and then realizing that their struggles doesn't really have a ready-made solution like others can find, itself makes them more vulnerable.
Correct.
Right? So basically they're already, if I am on a 0, an HSP is already functioning at a +2 and trying to find their footing to come to a 0. So yes, that does make them a little more vulnerable to everything else.
Right.
That's not a weakness. It's just the wiring which is different because of the background that they have come from.
Okay.
It can be neurodevelopmental, it can be nature, it can be nurture. And it can be external factors, because nobody traumatizes themselves.
Correct.
Whatever be the reason, yes, they are more vulnerable. Vulnerability does lead them to have experiences also which are little more negative. Finding acceptance into the mainstream itself is a struggle.
Right. So, I mean, again, to avoid like wrong diagnosis of HSP, could you explain how would you define someone who is a highly sensitive person?
Well, it's a longitudinal diagnosis. It's never one sitting in a clinical setting, nobody is diagnosed as an HSP.
Acha.
Because when you speak to a person, you will first diagnose a person to be anxious. The person is telling you that it is difficult for me, you are going to say the person is anxious. It's a very longitudinal diagnosis over multiple sittings, when one realizes that it's the sensory overload, or it's the difficulty in processing so much of information at one time, which is leading to the anxiety, or which is leading to this person to be overwhelmed but is not anxious.
Correct.
But the overwhelm is diagnosed as anxiety.
Correct.
But it's a longitudinal diagnosis. It is never a cross-sectional diagnosis, never a one-sitting diagnosis. And fortunately, the community of sensitive people, and the research that they are doing into their own patterns, and the work that they are putting out as saying that, okay, this is what we feel, maybe this is a research topic, and people are now doing a lot of podcasts and a lot of material that is coming out on HSP, is helping the cause. But it's a very new concept for clinicians like me who've been doing psychiatry now for 25 years to integrate that in our practice. We are also learning. The newer generation of psychiatrists may have it ready-made into their thing to kind of maybe recognize it as one of the initial differential diagnoses. For us, we are inculcating that into our practice. Because when we started practice, like I said, there were 5 illnesses, you were supposed to classify everyone into those 5.
Correct.
So, yes.
So, what's the difference between being sensitive and being empathetic?
Empathetic is to be able to understand the other person's struggles, not patronize the person, not sympathize with the person, but just be with the person.
Right.
Unconditionally.
Right.
Right? And be able to convey to the other person that I am there.
Correct.
Sensitive would be that I do nothing to hurt the person. I understand what the other person is going through, and I am able to act, behave accordingly to not cause a further dent to the person.
This is so nicely explained. I could totally relate to it. So, another strong emotion that people feel is anger. So, what is the healthiest way to express anger without lashing out, which is the most common output?
First, anger by itself is not a healthy emotion.
Oh, okay.
It's a natural emotion, but it's not a healthy emotion.
Okay.
Basically, anger is going to come out because you feel something is not being done your way
Correct.
or is not being done the right way.
Correct.
Right? Now, your way is not always the right way and not is the only way to do it. And what you believe is the right way may not be the only right way.
Correct.
So, the premise on which we feel angry itself is shaky, according to me. Right? Because it comes from the belief that this thing needs to be done this way. This is the only way to do it. It should be done. It must be done. Everything has to be only that way. Having said that, it's a natural emotion. So now when I'm getting it, the first thing that I need to realize is there is an A, B, C, D, E. So something has activated my anger. So let's take a simple example. We've asked the helper in the house to do something and she's not done it our way. The consequences is we are angry. Okay. Now A cannot go to the C without the intervening B. Right? A, B, C, D, E. So A is the activating agent. C is the consequence, which is anger.
Correct.
It's coming through a B. The B is a belief that it must be done this way, it should be done this way, it ought to be done this way, this is the way it is to be done, I want it done this way. Now what I do is I dispute the B. A, B, C, D. Maybe, could be, might be, possibly, and I dispute the B to see the effect, which is the E. So that's basically the logic behind all anger management. So best way would be to kind of first recognize the fact that I'm angry. Second is please move away from the place.
Oh.
Get out of the scene.
Wow.
Just get out of the scene and then think. Then do the stop. STOP. Imagine the traffic signal. Stop, think, observe, pause.
Very nice.
Stop, think, observe, process. Not pause, sorry, process. Go ahead.
Yeah, I think it's very important.
So that's another thing. In the interim, we also say move away from the place. Try to ground yourself. So the grounding, we usually say try to do some techniques like box breathing or trying to do something like a distraction grounding or do something to ground yourself so that you don't really have the outburst after you moved out. The various techniques of box breathing, distraction grounding, 5, 4, 3, 2, 1, many things. Another thing which is said is you can use the calm technique. Now in the calm technique, what you do is you hold on for some time and then you say, okay, let me focus on 3 things that I can see. So for an example, now I'll say I see the mic, I see you as the anchor, and I see this board. Fine. Now the next thing I do is 3 things that I can hear. So then I'll say, okay, I can hear this sound, I can hear this sound, and I can hear this sound. And then I get up and I move 3 parts of my body. Whether it's the hands, whether it's the neck, whether it's my legs, but I move and I realize I'm moving them. So my cycle of anger is broken.
Yeah, and the same helps with anxiety also.
Yes. So these are on the spot techniques, a few of them. And there are many, many more. I've just said
Yeah.
2 or 3 at the top of my mind. There are many, 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 many more. So basically, the answering your question, anger, what is anger? What is the premise of anger? Move away from the place. Try to ground yourself by all this. Outburst is busted by then.
Yeah. I think they just need to pause because,
Stop.
Yeah.
Imagine the traffic signal is what we tell everyone. Stop. You are in the green. Has to become red, then orange, then green.
yeah, very, very well put. So, coming to another strong emotion is sadness. Of course, I mean, according to me, the most sad thing for anybody is losing their loved one. So, what is the healthiest way to deal with the grief?
One, accept that grief is natural
Okay.
and it's not going to go away. So
Okay.
if you have lost a person, you've lost a person, a loved one, a relationship, a job, a promotion. Everything is a loss.
Correct.
Everything is going to cause grief, a breakup, a divorce, a theft, a robbery. It is a loss. And if it's a loss, it's a fact that it's a loss.
Correct.
It's not hypothetical. So the reaction to it is also there to stay. You have lost something. You can't tell yourself, why am I feeling sad? You have lost something, you will feel sad.
Acceptance.
Acceptance. It is going to go through its 5 stages of grief, the Kubler-Ross's stages of grief. You are going to be in denial, you're going to be in shock, you're going to be in anger, you're going to feel guilty, you're going to feel sad. All of it is going to happen. It is natural. It is the stages of grief. You're going to go through it. Accept it. Learn to live with the absence and the presence of the memories. If I have lost a loved one, if I'm going to tell myself that I can't live with this, what can you not live with? You have to live with the memories of the person. You cannot erase those memories.
Right.
So I have to learn to live with the absence of the object, person, relationship, XYZ, what I have lost.
Correct.
But also live with the memories of the same. I have to go through the process of grief. And it is a natural process of grief. If it is more than the natural process of grief, if it lasts much longer than the 8 weeks, then we call it complicated grief and it becomes clinical.
Oh, okay, okay.
But we do give it at 6 to 8 weeks for it to settle down. The first 1 year after any loss is extremely excruciating. And we have to accept it and navigate it with the help or without the help of a mental health professional.
Got it.
It is a natural process of grief. So, I will again compare it to a computer because that's the most easy thing to compare it with. If my hard disk is corrupted, what do I do?
Repair it?
How? I have to reboot it.
Yeah, yeah.
I have to wait for the new part to come.
yeah.
I have to fragment the hard disk again. I have to create the new backup again. It's a process, right?
Right.
And that's how the moment our computer crashes, we are all helter-skelter because we know now it's going to take 10 days to get the whole thing into order.
Correct.
Why is our mind not allowed that space?
Being patient also.
I lose a cord, charger to my laptop. Oh my God. The panic that is created because the charger to my mobile and my laptop is unavailable or is broken. I will go to any extent, to any website to get it immediately.
Correct.
Right? I have lost a relationship. Is it as fixable as a charger?
No.
But I don't want to, but the panic for a charger is much more than the panic for a relationship.
Yeah.
I expect my mind to be able to process it and get on with life. Not possible. Give it its space, give it its time.
So this emotion was about when we lose a person. Another draining experience is having someone who is not well at home, like a chronic
As a caregiver,
as a caregiver. So how should they deal with their emotions, and what do they go through in their mental health?
see, compassion fatigue and caregiver fatigue is for real. It is difficult. In many illnesses, one needs to realize that you cannot pour out of an empty cup.
Correct.
So, caregiver health takes precedence over the patient. So, you ensure quality of life to the patient.
Right.
You become a medical caregiver,
Right. Not
but
emotional.
emotionally, you become your own caregiver.
Yeah.
Having a caregiver community helps. Speaking helps, sharing helps. One feels, what is there to discuss? I have to do all this. How will discussing help? So, if there are three members in a family doing something, not everyone is doing the same thing, everyone is doing different roles.
Right.
They can sit and vent and rant about the role that they are doing, but it's out of their system. Talking, going to caregiver communities, taking breaks, extremely important. Extremely important as a caregiver. Get out of the scene at least for half an hour, twice a day.
Okay.
And that is not for buying supplies for the person who's the patient,
Yeah. For themselves.
for themselves. Chronic illness by itself is extremely draining. Emotionally, mentally, physically, financially, resourcefully, in every way. So one needs to understand that one needs to recharge and rekindle. And if, like I said, from an empty cup you can't pour.
Correct.
So compassion fatigue, caregiver fatigue is very known in today's date. It is difficult, but it's self-compassion, self-love, self-preservation, being aware of the fact that what's more important, what's the trade-off, is where the balance needs to be struck.
So this caregiver, does it also apply to babies when we're taking care of babies, or is it different?
I would say more in terms of chronic illnesses, which is what you mentioned
Yeah,
last.
yeah.
But when it comes to babies, baby is going to grow up in 6 months, man.
Yeah. We'll cut this question out.
No. Even if we come to postpartum mothers, that's a different entity. Yes, it's a draining process, and that's how now there's a paternity leave, fortunately by God's grace, added. But having said that, if you want to continue to include this, but yes, it is fatiguing. There is no doubt about it. It is very tiring, and there is this concept of postpartum depression and all that also. But also, it's a phase which each mother goes through, each to their own capacity, and you can see a finite end to it.
Correct.
The child's
Correct.
age is never going to be arrested at a 2-month or a 4-month or a 6-month.
Correct.
He is going to grow, he or she is going to grow, the child is going to grow and have their own stages. So you're going to grow and progress with those stages.
Correct.
Yes, each stage is very draining, but it's also, if you're a prepared mother, you're going to enjoy each bit of it because you signed up for it.
Correct. Yeah. It's very different.
So the two would be different, but yes, if you have a psychological baggage that a psychological issue that you are having through this initial maternity phase, there is help available. But most of the mothers, unless they have a psychological issue or they really have family issues, thoroughly enjoy their maternal phase through that 1 year, because all of them realize it's never coming back.
Wow.
It's never ever coming back. And
Yeah.
those are the memories which you cherish, those are the memories which you preserve. and those are feelings you may not ever live again, and you're never going to be as pampered as a female ever in this Indian society as much as you're pampered in those first 6 months.
So it's more of growth progression, and this one is more of decline. Yeah. So we have our last segment where we just have some rapid fire questions for you. The answers can be short or long as well. So what are a few habits you've seen mentally healthy people consistently practice?
Sleep hygiene.
What are the biggest myths about therapy and getting better that stops people?
It's too long a process.
But suffering is also a long process.
I want a quick fix. And my therapist may not be the best fit.
What's one trait that seems healthy but is not healthy mentally?
Perfectionism.
Wow. One book you advise everyone to read for being more mentally aware?
Man's Search for Something. Man's Search for Meaning by Viktor Frankl.
One ritual you never skip in your day for your own mental well-being?
After I get up, for the first half an hour, no screen.
Wow. One emotion you think the world misunderstands the most?
Empathy.
So they think they're being empathetic, but they are not?
No, it is misunderstood as patronization. It is misunderstood as parentification.
What's been your most challenging or memorable case that you've dealt with till now?
A girl I started seeing during my residency when she was in second grade, and today she's a successful corporate CEO.
Wow. She's still in touch with you?
And when she passed her 10th, till today, every milestone she calls me.
Wow. And what problem did she come to you for?
At that time, it was school refusal because of something that had happened in school. But each milestone of her life, she still calls me.
Wow.
And calls, it's not a message, it is a call.
Wow.
And I didn't have a mobile at that time when I had started treating her or speaking to her. She made sure she found my mobile email ID, and through that she got my mobile number. Today she's a mother of 2.
Wow. So you deal with so many people every day and so many heavy emotions. Doesn't it get draining for you as a professional, as someone who is listening to them? How do you manage to keep your own sanity?
One, very honestly, my support system is amazing. So I have friends who have held me together and encouraged me to an extent I can't even describe. And my second propelling factor has been my son. And having said that, yes, I had my training in under the best teachers and the one of the best institutes in Bombay. So that time our training used to be very, very intense. So the switch on and switch off phenomenon, which we kind of have learnt through our training, has been the biggest gift that training
Wow.
has given us.
Wow. I think that switch on, switch off should be taught to everybody.
But it's a part of psychiatry training.
Okay.
The only thing is why I speak about it today is today the awareness is more. That time so what we used to see was severe cases.
Yeah.
And still we had to go back and sleep. So that switch on and switch off has been more powerful than maybe what I would develop today if I was trained.
So, on the other hand, on a lighter note, what are the perks and what is fulfilling about being a psychiatrist?
I'm changing quality of life. And the gratitude is immense from patients. The way they keep in touch, the way they come and acknowledge the help is so humbling, I can't tell you. I couldn't be more grateful to the two people who are responsible for me being in this field, for facilitating that I am in this field. I couldn't be more grateful than, seriously, but the gratitude that I receive and the gratitude I have for those two people. It's a very humbling experience.
If every person could hear one message from you about mental health, what would it be?
Your mind is not your enemy, it's actually your partner. Walk the path together. The mind and the body together in sync will take you the greatest heights.
Great. So we have the last question for today. So after so many years of studying the human mind, what according to you truly brings people happiness, fulfillment and peace?
One fulfilling relationship,
Wow.
nothing else.
Yeah, I think that's very fulfilling. Great. I think, thank you so much, Dr. Jyoti. It's been very, very insightful speaking to you. And
Thank you so much.
thank you so much for your time.
Thank you for inviting me.
Thank you.
Thank you.
Thank you for watching this episode to the very end. If you found this episode to be valuable and insightful, then please like, share, and subscribe to our channel and let us know your feedback in the comment section below. Thank you.